A common question patients have when they are considering having rotator cuff repair surgery is arthroscopic surgery worth it, right? And so I'll start with saying emphatically, yes, it is 100% worth it. Actually, there was a kind of a debate back in the beginnings of arthroscopic surgery, like for rotator cuffs, like 20, 25 years ago. And I'm not going to name names. Well, I won't name the first name. There was an older surgeon who was very prominent in shoulder surgery, had written the book, literally written the book on shoulder surgery, but he was very resistant to the change to arthroscopic surgery. He thought it was silly. He thought it didn't matter. The old way worked fine. Why are we changing this, etc. And he said at a meeting one time that the arthroscope is the tool of the devil, right? And I was reading another article from one of the surgeons who I trained with in France, who was kind of on the revolution of arthroscopic surgery and, helped develop a lot of the new techniques that we have where we can fix almost all rotator cuff tears now arthroscopically, which is a radical change. And he said it's now time that we don't look at the arthroscope as a tool of the devil, but a gift from God, right? And I like to think of the latter, right? I think it's a gift from God. So it is a wonderful tool. It's a window into your anatomy, right? It's a window. So we can now see inside your body with these little incisions. And then what we do is develop tools that allow us to work inside those windows. And across my career, what I have seen is just this incredible explosion of arthroscopic techniques in the shoulder, specifically in rotator cuff repair. It's by far the most utilized form of rotator cuff repair now. It's the only way that I do rotator cuff tears is arthroscopically, and I will never go back to the old way because it's just so superior. It's smaller incisions, which is less pain, quicker recovery for patients. You can see more, you can do the procedure quicker, you can do it, as opposed to having to open up the shoulder. That takes a lot of time and it's a big whack on your shoulder. We do it through little poke holes. It takes less than 30 minutes. So we're way more efficient. The repairs are just as strong, if not stronger. You can see the patterns and the tears and the anatomy much clearer. It's all just very magnified. And so, I've done thousands of these, probably over 2,000 rotator cuff repairs, and I can never imagine going back to having to do them open. It would just be, it's like, going back in history for no reason. And so I think 100% having it fixed arthroscopically is the way to go for a myriad of reasons. The main ones are, less infections, smaller incisions, which means less pain as well, and then quicker operative times, and then also better repairs, in my opinion. And you want to make sure that if you pick someone to do this, that they do a lot. Okay, we do close to between 300 and 400 rotator cuff repairs a year, which is more than 99% of surgeons. Just make sure that whoever you choose, they do many arthroscopic rotator cuff repairs, and your chance of success is going to be very high.